Over 6,000 people have recovered from the new COVID-19 coronavirus, according to official figures. But health authorities in China have recorded over 4,000 new coronavirus infections overnight, bringing the total number of cases to more than 65,000. In the past 24 hours, over 100 people have died of the virus, mostly in its epicenter in Hubei province, where the mystery illness was first reported. Officials in the country have asked Europe for help, as Euronews' Trent Murray reports.
Pledging support in the fight against an epidemic. At a summit in Berlin, Germany's Foreign Minister Heiko Maas expressed his country's commitment to help in the counterattack against coronavirus. His Chinese counterpart Wang Yi was quick to remind Europeans that viruses know no national borders and called for international unity against the outbreak. On Thursday, a changed accounting methodology by Beijing saw a major spike in the death toll in China. For the World Health Organization, though, this is no cause for alarm.
To our understanding, these are not 13,000 new cases being added. These are a reclassification of suspect cases waiting for testing, but now have been defined as confirmed on their clinical basis alone. So we don't anticipate that there'll be another similar rises day in, day out, but we do anticipate that we'll have now both laboratory confirmed and clinically confirmed cases reported from Hubei.
In Cambodia, hundreds of cruise ship passengers were stranded for hours, while authorities there tested for possible cases. They were all eventually allowed to disembark this morning. In Wuhan, the epicenter of the outbreak, millions continue to be confined to the quarantine zone. Medical staff are working to treat the infected, with temporary hospitals constructed to ease the load on existing health infrastructure. But with researchers across the globe yet to find a cure for the new virus, all the people of Wuhan can do is wait, hoping their once thriving metropolis can bounce back from an outbreak that has left their city cut off from the rest of the world. Trent Murray, Euronews.
Well, for more on the European response, let's speak to our correspondent Shona Murray, who's in Brussels. Morning to you, Shona. We know that EU health ministers have been meeting to try and coordinate a response. How united, though, are actually all the different member states in working out how to deal with the virus?
Yeah, indeed, Rosie. They met here yesterday and really discussed one of the main concerns, which is how to break the chains of transmission of the coronavirus. There was an acknowledgement yesterday that this disease hasn't plateaued yet. So they agreed that the most important thing for member states to do right now is communicate factual information in a timely fashion to ensure that at least some of the spreading can stop. But each member state is responsible for their own actions. And obviously it depends on how exposed and how vulnerable they are. For example, in Barcelona in Spain, the World Mobile Conference has been cancelled. That was 100,000 delegates from 200 different countries supposed to turn up to Barcelona on 24th of February. It's been cancelled. There's been 2 cases in Spain of the coronavirus. In Italy, where there's been 3 cases, they've taken significant steps. They've ended all flights to mainland China, the only country to do so. They're also testing people at airports. The emergency authorities say they'll start testing people at train stations. Now, in Germany, the health authorities, where there's been 16 cases, say that testing people at airports does actually nothing. There's no substance to it. It just gives a veneer that there's some sort of activity taking place. So there are different efforts taking place in order to stop the spread. There are huge concerns about the economic impact, particularly in countries like Italy, which has a huge fashion industry where a lot of Chinese people used to come or do come and spend an awful lot of money there. So there's huge concerns across Europe about how this is going to impact. In France, a British family were found to test positive. The chalet in that family were visiting has been disinfected. But I think the consensus is that isolation is key for anybody who's suspected of having the coronavirus or does have the coronavirus. And all member states are also actively repatriating all of their citizens or have fully repatriated their citizens back to mainland Europe. Also, that was agreed yesterday by the health ministers with that there would be an ongoing insurance that there were medical supplies and other supplies like masks were available to member states should the outbreak worsen. But one thing that is key from a European perspective, and we heard this yesterday from the WHO, Dr. Michael Ryan, was that the profile of people who are actually dying from the disease hasn't changed, meaning that it's mainly people who have underlying health conditions and the elderly. He mentioned yesterday that anyone over 40, and as the decades go on, they're the people who are most vulnerable. And no one, of course, in Europe has died. But as I said yesterday, the health ministers did agree on several measures, as my colleague Darren McCaffrey reports.
With thousands infected and an increasing death toll, Wuhan and China have found themselves at the centre of a world health emergency. But for Europe, the impact so far has been minimal, though the expectation is that we're far from the peak of the crisis.
Only a few cases have been reported and confirmed in the EU. But of course, we all know viruses know no borders. We also stress that there is a need for continued vigilance by member states in case the situation as it stands today deteriorates.
As the EU's health ministers gathered for an extraordinary meeting in Brussels, the repeated message over and over again was that only by working together can they prevent further infections here.
Well, we now obviously need to coordinate on the barrier measures, on the way we work, the arrival of travellers, the research and epidemiological analysis of cases, also on the way we work on protective stocks, equipment, masks.
We know that we cannot exclude that the regionally limited epidemic in China might morph into a global pandemic. So it might get worse before it gets better.
Meanwhile, in Strasbourg, some MEPs are demanding stricter border controls.
For the EU, it's now important to be coordinated when it comes to a capacity check. Are we prepared, if there's more cases, to quarantine, etc.? We should have the same line in terms of communication. What are we going to tell our people? And we should have one line when it comes to what happens to people coming from outside Europe onto our territory. We have open borders, so we need to have one line when it comes to the external EU border.
And for officials and politicians here in Brussels, trying to strike that balance of preventing the spread of the virus and also the fear of its spread, well, that might be the greatest challenge yet. Darren McCaffrey for Euronews in Brussels.